Cerebroscope is developing an automatic concussion detection device that senses a unique electrical pattern in the brain that occurs following impact. This pattern has not been commercially exploited for concussion detection. Our customers are the many individuals who suffer concussions without clear and immediate detection and diagnosis, who are serviced by athletic trainers, EMS, and critical care personnel. Current concussion detection is based on post-concussion symptoms, whereas our device will detect the immediate and direct consequence of head impact. Our team and partners are seeking support to develop and test a prototype device. The challenges in concussion detection include the complexity of the current tests. Most of the tests require a pre-test, whereas ours does not, leading to increased time. And most of the tests involve subjective assessment, for instance, neurocognition tests. Most current tests have been shown to be not reliable by most studies and can lead to misdiagnosis and undetected subsymptomatic concussion. Our device is poised to meet the increased challenge of concussion awareness. There's enormous hype on concussion based on its reliance on the first-line detection and diagnosis that eventually will produce the symptoms that other methods depend on. The competing systems include neurocognitive testing, and this is an example of a symptom tester. It's at present the most prevalent concussion method, but has been supplemented by balance assessment and vision-based tests to increase its reliability. Subtle eye movements have been evaluated for detecting return to play decisions, and a modified EEG method has been proposed, but to our knowledge, not only been tested in severe traumatic brain injury in the emergency room, not concussion. The Cerebroscope solution depends upon this unique electrical pattern that's specific to concussion. It represents a way to have a portable device that can be fast, accurate, bias-free, simple to use, and it employs existing existing technology with modifications. The idea would be to take this device within a couple of minutes after an athlete gets hit, put it on their head, and let it sit there for 20 to 40 minutes, during which time the data is collected, and the device would say, yes, this pattern is there, or no, meaning concussion occurred or it didn't. How does it work? It's based upon a principle called, a phenomenon called cortical spreading depression, which is this abnormal electrical pattern in the brain. This has been experimentally verified to occur in animal models of concussion, which are not perfect, but it's never before been used in human detection. This electrical pattern also occurs in acute brain injury, in human acute brain injury, and it's been validated for that, and also is the basis of the symptomatology of migraine, aura. So it's an acceptable phenomenon in terms of current understanding. The device would depend on surface electrodes on the scalp and would employ commercially available EEG hardware with software supplied by us and with modifications. Our business model includes the retail sale of the detection device, which would include a control unit, sensor headband, and software. The sensor unit would assure proper skin contact over the period of the observation, dependent upon the electrode design. And it would be priced for affordability by target markets. The target markets include almost 4 million, up to 4 million concussion victims, and the academic sports institutions, first responder, emergency care centers, and medical military units and other places where concussion might be likely to occur would be the target audience. It also would be applicable to acute brain injury, stroke, and hemorrhage, which would include another approximately 1 million victims per year. Our revenue targets are angel and VC investors, of course. Cerebroscope was able to submit expanded SBIR to NIH in August, And we'll know about this sometime in late fall, which would supply enormous boost to our efforts. The current progress of Cerebroscope includes the filing of a provisional patent application. We performed a numerical simulation of the phenomena, which has led to a conceptual design and machine drawings of the prototype device with specific electrode requirements. We've forged relationships with an EEG device manufacturer with the proper equipment for this, which is a unique offering that TMSI has. And we have clinical collaboration, which is embedded in the SBIR grant with the University of New Mexico Neurosurgery Department for human testing of acute brain injury patients. The current goals are to add noise and drift to the numerical simulation. We would pursue a minimum viable product strategy to build a proof of concept device, which would then be evaluated in user surveys after the initial human testing and validation. Regulatory requirements would hopefully be satisfied because our device would fulfill the non-significant risk category and would be administered by the Human Studies Committee with FDA notification. The business organization would proceed as Cerebroscope progresses from seed to startup. Our team includes 8 founding members with a diverse experience in medical entrepreneurship, electrode design, computer simulation, virtual design, digital hardware, and clinical and basic neuroscience. Our lead business member has over 40 years of experience in the clinical EEG hardware development and sale. So thank you for your attention, and I'd like to entertain questions and further discussion.
So, Steve, you did a great job of explaining the product and some of the advantages over the current standards that are out there. What I would have liked to have heard more about is the value proposition. You know, is your solution 20%? You know, it's faster and it's portable, and those are both important things. But is it 10 times more expensive? Is it, you know, 50% cheaper? I think for future pitches that would be helpful. And just another suggestion you might want to think about is in your go-to-market strategy, what you might want to do is to see if you can partner with you know, University of Pittsburgh or some other entity that has an athletic program and do a beta and get some feedback from, you know, from the school. That would be very helpful with you know, with fundraising.
Yeah, we do have the value proposition, and it's based upon a lot of assumptions, and you know, you can sort of tweak it the way you want to, but the potential market for this is, the potential market is I think about $60 billion. So if you get a share of that, it's you know, in my mind it's unfathomable, but estimatable. This device requires multi-step production of a proof of concept and then human validation, and we've decided to test it in a known source of this electrical phenomena in acute brain injury patients. And this would then allow it to be validated as a detector, a scalp detector of this phenomena, which would be a unique solution, a unique finding, and then apply it to athletic concussion. However, we could jump into concussion, but there would be an unknown there, which might be surmountable. And developing a relationship with sports teams, I think, would be a very good idea.
Mike, I think you had a comment?
Yeah, I did. Do you have a neurologist on your team?
The senior business partner is sort of a multifaceted individual. He's a neurosurgeon with a business mind and also a legal mind. So he would fulfill that component. I can't say I could supply that knowledge. I've been a neuroscientist, research neuroscientist, always working in a hospital, and been very close to neurology and neurosurgery all my life. But you're right, the medical input is quite important.
Do you have...
And our collaborators at the University of New Mexico actually satisfy that. We have a neurosurgeon who knows how to do the proper procedure for the validation. And we have preliminary data that supports that.
Okay. Where was the technology developed? If you don't mind, I have a couple questions.
No, it's fine.
I used to be the investment director for the Pittsburgh Life Sciences Greenhouse, so I have a little bit of a background in this space. And I think it's something that's very interesting right now, and certainly a hot topic. But where was the technology developed?
Well, the scalp detection of this phenomena has been a target of all the scientific investigations that have observed it on the brain surface, where acute brain injury patients have had to have their brain exposed. So there's been very, very limited understanding of how to detect this on the scalp. And our numerical simulation is the best proof of concept that we have at this. So this represents a combining of not really EEG, it's DC EEG, which is an anathema to clinical EEG. It's a particular electrode design and electrode characteristics that really haven't been put together yet. So it's a combination of things that have forged.
So you're taking some existing technologies and you're putting them together in such a way that you can perform a diagnostic. Okay. And you have any licensing for any of that yet, or are you still early in the game?
Oh, we're very early. This is an idea with a numerical simulation and a lot of scientific support. My science colleagues, you explain it to them and say, sure, but it's never been done. And in terms of business advance, you need the proof of concept, you need the device, you need to show that it works. And so we need to go that path to go further, in my mind.
Good luck with the SBIR. I think you're starting in the right spot, and I hope that you advance this.
Well, one of the reasons I'm making this pitch is because NIH is notoriously fickle with grant submissions, so you know, that's why we're out there in the entrepreneurial world.
Well, I feel like I'm sitting next to the experts, so I don't have too many questions. I just have, for your pitch, I like the story. There's a clear need for the market. I think that the logo was great, but it would be great if we just see a photo of the device. It puts it all together for those that aren't technical, like what are we actually seeing? Because that's the star.
I could add that we have a little more than a schematic diagram of it, but it's basically a electrode array that goes on your head with either Wi-Fi or wires coming out of it. So, thank you.
Thank you, Steve.